Hello, and welcome to a presentation on self-direction, sponsored by the Nebraska Department of Health and Human Services, Division of Developmental Disabilities. Self-direction empowers people with disabilities and their families to design and manage services based on their individual needs and goals. Self-direction supports the essence of community inclusion, and because the person-centered plan is individually created by the participant and those the participant chooses to help, each plan is as unique as the participant who designed it. Participants control their own individualized budgets and hire and manage their own staff supports. Person-centered plans and budgets allow participants to access the supports needed to live at home, pursue interesting, meaningful employment, volunteer or other community activities, engage in satisfying, productive relationships with family, friends, and community members, and maintain a healthy lifestyle. The agenda for this presentation is to give the viewer a brief overview of self-direction in Nebraska. We'll start with how the self-directed model differs from the traditional service model, provide a brief history of self-direction, describe the elements of self-direction, offer a few tools for managing self-direction, and discuss the waiver services available in Nebraska that are yours to self-direct. We will then close with a few final thoughts. We'll now take a look at how the self-directed model differs from the traditional service model. Person-centered planning is a way of organizing around one person to define and create a better future. Thousands of people and families in Nebraska have used person-centered planning to help them make decisions and changes in their lives. Typically, in person-centered planning, the participant invites people who know and like them to come to a meeting. The service coordinator guides and records the discussion and decisions. After the meeting, people do what's been agreed. This hardly sounds revolutionary, but the frame of the meeting, the questions the meeting asks, and the way the meeting is organized often mean new possibilities emerge, new understandings develop, new alliances are formed, and people's lives take a definite turn for the better. Strong person-centered planning is foundational to strong self-directed service delivery. Self-direction is a means by which participants are empowered to gain control over the selection of services and supports that meet their own unique needs. Self-direction is not built around particular services or programs. Rather, the self-directed approach to service delivery begins with the participant designating what kind of life activities are desired and what kind of help is needed in order to attain those life goals within the community. While service options may be selected from choices already available through the existing service delivery system, the goal of self-direction is to allow participants to create opportunities for themselves in the social and economic communities in which they live. This slide describes the difference between Nebraska's traditional and self-directed models of services. You can see that in both models, the participant is at the center of the wheel. In the traditional model, the participant works closely with their agency, family, and friends to determine needs and services. The agency then recruits workers who report to the agency. The agency sets the implementation plan of services that will be delivered to the participant, specifies the worker's salary and benefits, defines the worker's normal work-hour schedule, and ensures that the worker receives all required training. In the self-directed model, the participant works with the family and supporters to make decisions about their needs and services. The participant, with support as needed, then recruits and manages their own workers. This includes describing the tasks that will be provided to the participant, specifying salary and benefits are optional in this case. The salary is provided within the parameter described in Nebraska's home and community-based waiver. The participant also works with the workers to assign a flexible work-hour schedule that meets the participant's needs. And finally, the participant either trains or arranges for all worker training, including those trainings mandated by the state of Nebraska. Self-directed services and their benefits on participants and their families have been heavily researched over the past 25 years. These studies consistently find that participants who were able to self-direct have a higher quality of life. People who self-direct have more positive outcomes, including employment, independent living, and community inclusion. Self-direction is associated with higher self-esteem because people are able to choose the lifestyle and preferences they desire. Higher independence, autonomy, and control all contribute to increased satisfaction of services and supports. We will now take a brief look at the history of self-direction in the United States. It's important to note that self-directed models operate side by side with agency-managed service delivery models. Participants and their families differ in the extent to which they wish to take on full management of their services. Some participants want to exercise a high level of control, while others prefer to have services and supports managed by a provider agency. Consequently, participants are not faced with an either-or proposition in Nebraska. Instead, they have a full range of options available to them. These options began in 1972 with the commencement of the independent living movement in Berkeley, California. Ed Roberts, the director of the first independent living movement, the Rolling Quads organization, created the self-directed personal attendant care concept. By the 1980s, self-direction was prevalent in the personal care world as a viable option. In 1993, self-direction options for home and community-based services were included in the President's health care reform recommendations, and proposed legislation was introduced in Congress. The Self-Determination for Persons with Developmental Disabilities program was a national program that began in 1995 to help 19 states implement a more cost-effective system for serving people with developmental disabilities, while simultaneously giving those individuals and their families more choice in determining the services they received. Shortly thereafter, 15 states were afforded cash and counseling demonstration funding by the Centers for Medicare and Medicaid Services. This funding was used to support people with physical disabilities and seniors with high support needs in their pursuit of self-directed service options. The Robert Wood Johnson Foundation sponsored 2 research studies for their self-determination project. The studies found that collaboration of all disabilities stakeholders was critical in terms of providing information and other resources to participants in supporting self-determination in the community. Self-advocacy came of age in the 1990s and was an especially important ingredient to moving self-direction into the forefront of State Division of Developmental Disabilities policy considerations. The research studies cited the importance that all system partners needed additional training and adjusted roles so that they did not become barriers to self-determination. As you all know, transportation matters. It's a key to independence. Finally, small changes in a person's life might be exceptionally important to that person, to their quality of life. It just depends on the context. As you can see, in the 1970s and 80s, very few states had self-directed programs available to persons with developmental disabilities or people with other disabilities. Today, this picture has dramatically changed. All states in the country have some type of self-directed program for people with developmental disabilities, physical disabilities, or seniors with high support needs. We will now take a look at the elements of self-direction that are essential to participants to plan and manage their own services. This pie chart depicts the elements of a self-directed program as found in Nebraska. Self-direction begins with person-centeredness. The person-centered plan is known in Nebraska as the Individual Support Plan, or ISP. From there, the participant has an individual budget, and that budget is used to hire the staff necessary to provide services and supports. Service coordination provides information and assistance, and a financial management service exists to receive worker invoices and make sure they're paid. The participant exerts choice and control over the services and supports. This begins with the individual support plan developed with help from the team. The support plan is modified as needed with assistance from the participant's service coordinator. The participant authorizes payment to their staff via Nebraska's electronic records system, which also takes care of payroll and tax withholdings. Participants are responsible for managing their own spending according to the services described in their individual support plan. The electronic records system generates utilization reports in order to assist participants to monitor their spending. It's important before going into self-direction that the participant understands, respects, and accepts their core responsibilities and authority. This includes supervising, hiring, training, removing staff as needed, fully participating, openly communicating with both their workers and their service coordinator, accepting and following program limitations, asking for help when it's needed, and following the plan. It's very important that the participant and a representative report what's working and what's not to their service coordinator. In self-directed programs, participants may direct many or all of their home and community-based services, including selecting and managing independent providers for needed services. If a participant is unable to manage their self-directed services or feel apprehensive about doing so, they may choose a representative to assist them. This slide outlines representatives' responsibilities and the scope of commitment to the participant. A representative is typically a family member or close friend who assists the participant in making decisions based on their desired preferences. A participant still directs how and when services are provided, but a representative may offer assistance with some of the tasks the participant may find daunting. For example, a representative may review timesheets and talk to the provider or take corrective action if an independent provider fails to perform tasks. In some instances, representatives may perform all of these duties on behalf of the participant. Not all participants want or need a representative, but such a person can be helpful. The service coordinator will discuss this option with the participant, and if the participant agrees that they would like this type of assistance, the service coordinator will provide suggestions to the participant on how to identify potential representatives. A representative may also be someone who serves in other roles to support the participant. For example, a representative payee or legal guardian. The independent provider is an essential element of the self-directed model. The provider is managed by the participant and/or their representative. The individual support plan describes the tasks that the provider will be performing in order to support the participant. The service authorization describes the number of hours that the provider will work. Nebraska has an electronic record system where the provider submits their time card. The independent provider is responsible for preparing habilitation plans that describe how they will meet the terms and conditions of the individual support plan. And finally, the independent provider must document the service delivery in THERAP, Nebraska's electronic records system. The service coordinator's role within the self-directed model is to provide information and assistance. The service coordinator assists the participants to develop and/or modify their individual support plan, including creating the plan to self-direct their own services and supports. The service coordinator monitors the plan and delivery of supports to the participants. The service coordinator also manages the service authorization process and provides guidance with recruiting, hiring, and managing staff. It is important to note, however, that the service coordinator does not perform these tasks directly. Generally, the service coordinator monitors how self-direction is going for the participant. Is the participant happy? Do the services meet their needs? And is there anything else that might make self-direction work better for them. The service coordinator is also a resource to assist the participant in looking for ways to meet their needs by using informal supports in addition to provider supports. Service coordinators provide information and assist participants in connecting with their communities. The Nebraska Department of Health and Human Services, or DHHS, has a global role in overseeing self-directed supports. The Division of Developmental Disabilities oversees individual support plans, including support budgets that are submitted by service coordination throughout the state. The Division of Medicaid and Long-Term Care approves potential independent providers through the Medicaid provider enrollment process. The Developmental Disabilities Service Coordinator monitors participant budgets through utilization reports supplied by the electronic online records system. The Developmental Disabilities Quality Review Team ensures appropriate services from service coordination and the fiscal management service tasked with reimbursing independent providers. These quality assurance activities serve to ensure acceptable performance by the system, protect participants, and improve future services. They are a major component of a strong, self-directed system. We will now take a look at the elements of self-direction that are essential to participants in order that they can plan and manage their own services. The National Association for States United for Aging and Disabilities, or NASUAD, developed a series of probes to determine the capacity of a participant to self-direct. Should a participant not be willing or able to self-direct, they can, as noted previously, always have a representative to assist them. The probes are a means of understanding if the participant has the ability to make choices, set goals through their individual support plan, be aware of what is adequate or inadequate support, and make changes to how their services are provided if necessary. The second premise is to assure that the participant has the ability to monitor their services independently or have readily available assistance. This is the quality assurance function that the participant themselves must be able to manage. Nebraska is not using these probes today. This is simply an example. The probes begin with the individual support plan. What services does the participant want and need? Included in the individual support plan should be a discussion of what other things would help the participant be more independent that they are not receiving now. The probes go into recruiting and hiring independent providers to help the participant in the home. The participant must be able to have a plan to train and supervise their providers and give their providers feedback about what's working and what's not. Self-directing participants must be able to discuss with their independent provider any concerns that they have. It's important that the participant has a backup plan in case the independent provider calls in sick or fails to appear. Does the participant know how they would get their needs met? Additionally, does the participant know how to respond in the event of an emergency? The probes ask if the participant is willing to accept help from their service coordinator if needed, and if they want to appoint a representative, who would that person be? Again, these probes for determining capacity are not being used in Nebraska today. These are simple examples of what determining capacity to self-direct might look like. This slide has a variety of suggestions for the participant's interview with the prospective independent provider. It's important for the participant and the representatives, if any, to spend time thinking about exactly what tasks they will want their independent providers to perform. Although flexibility is a key quality for most independent providers, a potential job applicant will want some specific information about what the participant wants them to do. For example, let's say the participant wants to have an independent provider available at dinner time. Does the participant want the independent provider to cook dinner for them, teach them how to cook, help them cook, or simply be in the vicinity while they cook independently? The service coordinator is going to be a great resource in helping participants determine how best to advertise for independent providers. One of the principal tasks of service coordination is to monitor the implementation of the individual support plan and identify any causes for concern. This slide and the following slide detail those causes for concern. As you can see, they begin with how the independent provider is supporting the participants. It's important for participants to do their own performance evaluations of their workers. Some states recommend that the participant conduct the first employee evaluation approximately 3 months after a new hire and then twice a year after that. These evaluations don't have to be long, but they are an important way for both participant and their independent provider to check in with how things are going. The service coordinator reviews documentation and, in interviews with the participant, takes note of how often independent providers fail to report to work, how often backup employees are used, and how often there are changes in employees. Service coordination keeps an eye on family and participant satisfaction with both quality and quantity of services. Is the participant's schedule flexible? One of the key pieces of self-direction is that the participant is living the life of their choosing, and are the independent providers assisting that individual making sure the participant is doing just that. This also includes engagement in community life. The service coordinator monitors the individual budget to ensure that it is sufficient and receives other complaints, concerns, and suggestions from the participants. Service coordination is equally concerned about over- and underutilization of services. If services are underutilized, the service coordinator may ask questions to determine if health and safety are being adequately supported. The service coordinator is also monitoring the individual budget to assure that it is sustainable over the plan year. The service coordinator closely monitors any ongoing difficulty that a participant may have in arranging for services needed for health and safety, and/or the participant's inability to supervise or fire an employee effectively. And finally, the service coordinator is active in monitoring the individual support plan to ensuring that it is implemented as it was developed. The service coordinator can always ask for a meeting of the team to modify the plan if needed. The Nebraska Department of Health and Human Services, Division of Developmental Disabilities, has taken a number of steps to enhance self-direction in the state. The next few slides detail some of those activities. The state has recently expanded the definition of who can be an independent provider. In addition to a provider being a neighbor or friend, a provider can now be a family member as long as the family member is not legally responsible. In other words, the family member is legally responsible and cannot be an independent provider if they are the parent of a child participant under age 19, a legally appointed guardian to the participant, or the spouse of the participant. The Nebraska Department of Health and Human Services, Division of Developmental Disabilities, is focused on strengthening the independent provider network to build capacity and skills. This includes certain enrollment requirements, including CPR, first aid, abuse and neglect training, and either education or experience. Independent providers must have the ability to write habilitation plans. These plans detail the activities that will be provided to the participant in the implementation of the individual support plan. Participants have full authority to hire, train, schedule, supervise, and dismiss their independent provider as needed. This slide has a list of the waiver services currently available for self-direction in Nebraska. The Division of Developmental Disabilities has submitted waiver applications to the Centers for Medicare and Medicaid Services. Included in those waiver applications is a refinement of self-directed services. As you can see, the self-directed aspect of pre-vocational will end when the 2019 waiver amendments are approved. The pre-vocational service will continue to exist, but will only be available from agency providers. Starting with the approval of the 2019 waiver amendments, The following day services will be available for self-direction: habilitative community inclusion, supported employment follow-along, and supported employment individual. For residential services, supported family living and independent living will be available. The other services, much like in current waivers, that will be available are assistive technology, consultative assessment, environmental modification assessment, homemaker, home modifications, transitional support for participants moving out of an institution, transportation, and respite. To ensure that self-direction remains a viable desired option for participants in Nebraska, a number of questions may be considered, such as what's working and what's not working right now in the self-directed model in the state. What are the challenges for increasing the number of people who choose self-direction, and suggestions for how those challenges can be addressed? Are there any health, safety, fraud, and abuse safeguards that need to be put into place to protect their rights and safety of participants? The Nebraska Department of Health and Human Services Division of Developmental Disabilities supports the choices of individuals with developmental disabilities and their families within communities by promoting and providing services that are person-centered, self-directed, flexible, community-inclusive, and supportive of the discovery and development of each participant's unique gifts, talents, and abilities. The division is committed to work towards service options to ensure that people with intellectual and other developmental disabilities have the opportunity to have fulfilling and meaningful lives by allowing them to contribute to and enjoy their communities. Participants and their families report a high level of satisfaction through the increased control over services, the ability to more fully integrate into their homes and communities, and the benefits of the self-directed community life. Thank you for viewing this presentation.